Increasing cases of COVID-19 plus new CDC recommendations have left a lot of people in a bind trying to figure out what to do with the upcoming holidays. Joining us tonight to provide a little more context on those recommendations, Dr. Dale Bratzler. Dr. Bratzler is a chief COVID-19 officer at the University of Oklahoma, also a fellow with the Infectious Disease Society of America. Dr. Bratzler, thanks for joining us tonight. You work in a university setting there. For students who weren't tested before they left campus, what would you say to those kids going home for the holidays and also the parents who are ready to welcome them?
Well, we certainly encourage, I think colleges across the nation encourage students to get tested before they went home. We know that not all of them will or did get tested. And so we're strongly encouraging students that if you go home, wear a mask, practice all of the physical distancing, hand washing, and mask wearing that you do on your university campus when you go home, because the risk of transmission is still very great. We know that community spread of the virus is substantial right now in the United States.
Let's talk about the vaccines, doctor, because we had big news about yet another one today. Will ultimately all of these go before the FDA for approval? Is that the plan?
Yeah, I think so. And there are many others that are still in development. So I think we're going to see potentially a lot of different vaccine options. You know, two of them will likely go before the FDA very, very quickly, the two RNA vaccines. And the preliminary data looks very, very good. I think most of us in the medical community don't think that the effectiveness of a vaccine will be 95% in the general population, but in the studies it looks very, very good. But other vaccines like the AstraZeneca one that was announced today will go before FDA for emergency use authorization, I think in the near future, and we'll have several different options to vaccinate patients.
Yeah, I hate to put you on the spot with this because I'm not sure how much you know about these vaccines, but will they be free, do you know? And I thought I remembered early on in this process, there were some who were saying whoever figured out this formula, they would give it away to everyone for free to be able to get this vaccination in more people's arms.
So as a part of Operation Warp Speed, where these companies were given millions of dollars to go ahead and produce the vaccine while they were still doing the testing, those vaccines should be distributed for free. So we expect that at least the initial companies that bring vaccine to the market, those vaccines will be free to the public. Now, that doesn't necessarily mean that all of the administrative costs, particularly if you're a non-Medicare patient, will be covered, but that should be about the only cost, at least for the initial vaccines, would be the administration costs.
Okay, so we're hearing from seniors, doctor, and I'm guessing that seniors and healthcare workers, these are the folks who will get access to this vaccine first. Seniors who might be concerned that they've had reaction to other vaccines in the past. Is that reason for them to worry about this?
Well, first, vaccines in general are incredibly safe. There have been numerous studies that show that vaccines can be taken safely and don't cause adverse effects. There are adverse effects that can occur with any vaccine, but the preliminary data for these two vaccines that are likely to be approved first appears to be very good, very safe, with minimal side effects. So I would strongly encourage anybody that's in a high-risk category to go ahead and get the vaccine as soon as you have the chance.
So I was wondering about that, doctor. Is there anything in this vaccine that would give you pause from a safety? In other words, is there some unknown ingredient or chemical in it that hasn't been tested or that might be worrisome?
So the only point I'll make is that the two vaccines that will likely be approved first are RNA vaccines, which is a new technology that we haven't used before. And just remember that the clinical trials of these vaccines, at least these two, just started in July or so. So there's not going to be years of safety data. But preliminary work looks like the vaccines are very safe. Both vaccines have enrolled more than 40,000 people in the clinical trials and have not shown any serious side effects. And I'm also told by some of the vaccine researchers that they've been studying this type of vaccine for many years and feel that the profile of these vaccines is quite safe. So I will take one when I get the opportunity.
Well, on that, we have 10 seconds left, Dr. Bratzler. Will people have a choice of which vaccine they want to get?
Yeah, maybe not at first, because remember the Pfizer vaccine has to be stored in ultra-cold storage. Moderna, not quite as cold. So it may depend on what's available in your state or your locality that you may be offered.
Dr. Bratzler, it's great to see you again. It's always a pleasure to have you with us, and we appreciate your time.
Yeah, it's my pleasure.